Okay, so I've got Erica here with me. She's actually Anne's daughter that I talked to last week on video. And Erica is very excited to be on video in front of all of my 9 YouTube subscriber fans. I'm grateful to have you here. Thank you for doing this.
Thank you for inviting me.
Yeah, so I mentioned last week in kind of the intro video with Anne that we're going to be doing a frugal skincare swap where I'm challenging people I know to let me swap your regimen from a more expensive one to a more affordable one. And I just want to see how it goes. I just want to see. I'm too cheap to buy expensive products, so I can't compare. But I want to ask people who have been using more expensive products how it compares when you start using a more affordable one, if you notice the difference or if you don't.
Okay. And I have been using expensive products. I have been going to a medical spa to have, facials and stuff. And then when they say, oh, you need to use this cream to help with, help maximize what we just did. And it's $195 for a bottle, and I kind of want to die inside a little bit. So, and I bought them, and they work wonderful, but then when they run out, I'm like, I don't have $200 to replace every single bottle of what I'm using, and it's way too much money.
Yeah. Okay, let's talk about what products you've been using. So tell me what kind of your long-time products are that you've been using for a few years now.
Okay, for a few years, I've been using retinol, just different brands of retinol, but that's one that I've tried to, as I'm aging now, to be a little bit more consistent. I will do products that have glycolic acid in it, but the ones lately, I guess maybe in the past year that I've been using, are it's called a TNS ceramide. I've been using that one, and then I've been using one called Litera 2.0, and I don't know what what these do, but those
you don't know what they do.
I don't know what they do.
But they're expensive.
But they're really expensive. But I have noticed, my skin does look better.
Yeah.
I think most of it is targeting pigmentation.
Yeah.
Because I spent a lot of time in the sun in my teens and early 20s. I was a late 90s, early 2000s teenager, and we spent a ton of time in the sun.
Yeah.
So.
Okay, so Litera, I think Litera. Does Litera have hydroquinone? It's supposed to fade. It's supposed to kind of be
so
a
it's
bleaching
for
agent.
dark spots. Yes.
Yeah, Litera is definitely, as far as over-the-counter bleaching creams go, is a very good one.
Okay.
The other one was the TNS serum. That's SkinCeuticals.
Mhm.
Litera SkinCeuticals.
Litera is either Skin Medica or SkinCeuticals. I don't know which one is which, but I have used both Skin Medica and SkinCeuticals.
I think it might be Skin Medica. Okay. Okay, and each one of those is over $150, right?
Yes, easily. And they're not very big. So I treat it like it is gold, and I only use very small amounts because I'm trying to stretch it out because I don't want to have to buy it, every 3 months. So it's.
Is that what it lasts you, 3 months?
For me, probably closer to 6 months because I'm very careful with it. So yeah, I stretch it out as long as I can.
Okay. And why did you buy those 2 products?
I bought them last year. I was diagnosed with melanoma on my cheek right here. And so they have helped with scarring. I also have old acne scars that I wanted to fade, and so those are my main concerns. Okay.
And the retinol that you've been using is just in various products, you said, but it's just retinol, not prescription strength.
No,
it's been retinol.
Just retinol 1% or like 0.5. Is that 0.5 or 1% retinol? Is that probably what an over-the-counter retinol would be? So that's the strength, but no prescription.
No prescription retinoids. Okay.
Mm-hmm.
Okay.
No prescription retinoids, but I would say all the products that I'm using are targeting hormonal acne, which I don't know what happened in my 30s, but something hormonally kind of changed and I was breaking out more than I liked. So acne and pigmentation.
Okay. So are you still dealing with acne or just the acne scars?
Not so much acne anymore because I switched over to what you had recommended for acne.
On Instagram.
Yeah, and I mean, as soon as you did it, like I hopped on Amazon and I bought it, and I've been using it now for, how long has it been since you posted that?
Several months.
6 weeks, 7 weeks, yeah, 8.
At
It's
least.
been a while. So I've been
So
using
you got
that.
the adapalene gel, La Roche-Posay?
Is that the different?
Oh, did you get the different?
I got the different. So I got the
It's the same.
CeraVe.
It's the same active ingredient, but you got the
Okay.
different brand.
Yes, I got the different.
Okay,
brand.
so different is adapalene 0.1% gel,
Okay.
and you're using that once a day.
Yes, I use it at night. After
Are you
I wash
using it
my face.
instead of your over-the-counter retinols, or in addition
Yes,
to?
I've replaced
Okay.
my retinols with the different
Okay.
gel.
And you're using the benzoyl peroxide face wash. Okay.
And then that toner. I don't remember the brand of the toner it is, so I use the face wash.
Was
I
it La
use the.
Roche-Posay? Does that sound right?
I think it starts with the E. Does it?
Okay, I'll have to go back and look at it. I can post it on Instagram.
Okay.
Here.
So I use the face wash, I use the toner, I use different gel, and then I also use a CeraVe. Is it CeraVe or CeraVe? Either one.
Either one's fine.
However you want to say it.
It depends on what you
And then I found a moisturizer that actually, I Googled it because I wanted to find a triple lipid. You know, the SkinCeuticals or the SkinMedica triple lipid moisturizer, and this CeraVe one was supposed to be
Mhm.
comparable to that, but it's $13 instead of $200. So that's the moisturizer I am using, and I actually really like it.
Okay, interesting. How does it compare? You feel like you like it just as much?
Yeah, I mean, I have only tried a sample of the triple lipid, but it's very,
I see.
very comparable
Okay.
from, the sample that I used.
Okay. So you never had a trade size that you used for a while?
No, not of
Triple
the triple lipid.
Because part of the thing with skincare is placebo effect, right?
Mm-hmm.
If you're using a more expensive product, you trust that it works better.
Yeah, yeah.
And sometimes they do, and sometimes they don't. But either way, you kind of feel like you're
You
getting
feel
what you
like-
pay for.
Yeah, if you're paying for more, then it's gonna do more for your skin. If you're paying a huge amount for it, where, I mean, I bought it on Amazon. It had 13,000 reviews and 5 stars, and the internet said that it was that it was comparable. So let's trust the internet.
The CeraVe is the one that
Yeah,
had. Okay.
the
So is
CeraVe.
it the CeraVe cream?
Yep, it's just like a nighttime, a restorative night
CeraVe
cream.
PM.
Yes. I
Okay.
use it in the morning too because I have dry skin as well. So I use it morning and night.
No, you can't. It says PM. You can only
You
use it at
only-
night. Okay, so the CeraVe PM, and you like the way it goes on?
Yeah, I love it.
Okay.
Yep, it's probably one of the better drugstore night creams that I've used.
Okay.
I like the consistency. I like how my face doesn't feel tight and dry in the morning when I wake up. So it's in my top 5.
Okay.
Maybe top 3.
Okay.
Top 3.
Okay, so with Anne, I kind of designed her regimen behind the scenes. I talked to her, I asked her what she was using in the Obagi series, and I kind of found a comparable product for each one of those.
Okay.
For Erica, we're just meeting actually for the first time right now. And so I'm just learning about her skincare regimen. What I'm gonna do is design a more affordable regimen for her, and I can post on Instagram the products that I eventually recommended to her. But right now I'm just trying to figure out what you're using and why. And so if we were to talk about why, it sounds like you want something that addresses acne scarring.
Mm-hmm.
Do you still feel like you need something for hyperpigmentation?
A little bit, yes. And like, first of all, how unfair is it that my mom, who, has 25 years on me, like my mom has incredible skin.
She does.
And unfortunately, I did not inherit my mom's skin, or maybe I did, and then I damaged it myself, with sun exposure. And I remember one time you posted, what is the one product that is the best anti-aging product out there? And it was sunscreen. And I didn't wear, I know, if only I would have known, but my mom has incredible skin, and
You both have nice skin.
well, I've had to work very, very hard, where hers comes a little bit more effortlessly.
Yeah.
Mine, I have to work really hard to have this.
She looks great. What's your sunscreen now?
I just use an Obagi. I mean, it's from my mom, so I use the Obagi sunscreen. And I use it every single day in the summer. I'm not as great in the winter because I'm not outdoors, and I know that I should still be using it. But I also, my foundation that I use
Has sunscreen.
has
Okay,
SPF 50.
Yeah.
So the It Cosmetics foundation has SPF 50 in it, so I feel like I'm kind of okay that way in the winter, but definitely in the summer I'm using Obagi face sunscreen.
Okay. I'll be completely honest. I think differently than a lot of dermatologists about sunscreen in the winter. I think it's kind of popular to say on Instagram that you have to wear sunscreen in the wintertime because you still see the sun through your car window or through your office window, which is true, and especially with a history of skin cancer, you want to be more on the cautious side. But that said, I don't wear sunscreen every day in the winter, I'll be completely honest.
Okay.
I think that 15 to 20 minutes of unprotected sun exposure is fine.
Okay.
I mean, that's just me. And I probably have a history of skin cancer because I'm fair skinned and I've had a lot of sunburns.
Light eyes, fair skin.
And so, even with what I know as a dermatologist, I mean, yes, you probably should wear something with SPF, but I feel like your foundation with SPF is probably sufficient, if I'm being completely honest, during the wintertime. I'd be a hypocrite if I expected you to when I'm not. Because I drive to work and yes, there are UV rays through the window, but still, I go home when it's dark, and so I get 20 minutes of UV light through my windows.
And that's okay.
And I feel like that's giving me vitamin D, and not all ultraviolet exposure leads to sun damage. I think that there's a threshold after you've been out in the sun so long, then you start getting to the point of sunburn and damage. But to a certain extent, you've got...
came from tanning beds, I think, and not like the natural sun. Mine was from indoor tanning beds.
Absolutely, that's just high doses of UVA portion of the ultraviolet spectrum and highly damaging, yes, absolutely. But as far as your risk in the wintertime, if you are not out in the sun, I mean, maybe if you're going to be out more than 30 minutes a day, you put on an actual sunscreen.
Okay.
Yeah. So I think probably just stick with the foundation. I think that's fine.
Okay.
CeraVe makes an AM and a PM. You like the PM. At some point you could try the AM and see if you like it. The AM has sunscreen.
Okay.
It's a moisturizer with sunscreen in it with SPF.
Okay, I will try that.
Yeah. Okay, so sorry, we got sidetracked there. So
it's okay.
So as
we
far
can
as
talk
what
skincare for hours. I'm cool with it.
As far as what you're going for, I need to figure out what categories of products I need to include in your regimen. Sounds like you want something to address the acne scars, but really retinoids is your category there, and you're using the adapalene, the different gel. So I think we're okay there.
And most of my discoloration is along, and I think that's probably common for women. I mean, I don't really know, but I had, before I started using retinol and some of these products with a more active ingredient, I had pretty bad pigmentation issues, kind of the mask. So I had bad up here and then on my forehead. And so not so much in the center of my face, but it was kind of along, like where the sun really hits you.
Was it more melasma?
Yeah, like melasma.
It wasn't from prior acne pimples?
So no, the acne scars more were concentrated around because when I get hormonal acne, I get it on my chin. So it was more concentrated around my mouth. But the melasma was more on the outer sides of my face.
It was hyperpigmented patches. Okay. You feel like you still are kind of battling that during the summertime?
Not during the summer. Yes, it's crazy how just like one day out in the sun can like bring all of that back. You know, and it's so frustrating because you work so hard to get rid of it, and if you are not on top of your sunscreen, one bad day out in the sun and it is back.
So I talked about this with your mom. She doesn't have melasma, but she wanted to address hyperpigmentation, although, I mean, I don't know how much she actually has.
I know.
Maybe she just wants the brightening.
I know.
But I told her about a prescription fading cream that, in my opinion, is more effective than anything you can buy, including Lytera.
And Obagi, right? Because Obagi is known for, I mean, it has that hydroquinone in it.
Yes. I don't remember the percentage of hydroquinone in the Obagi. I'm sure they have varying percents, but in your mom's line, I can't remember if it was 4%. I start with
think it
6%
is.
hydroquinone, and I
Okay.
also use other fading agents, kojic acid, and then a topical retinoid, which helps to kind of exfoliate the top layer of skin, and that also, like the
Okay.
adapalene, will help somewhat with the hyperpigmentation in and of itself. I'll take a look, but I think maybe relying on retinoids is going to be your best bet, because
Okay.
retinoids are so versatile, and the different gel I think is a great starting point, because when you're using retinols in products, I don't know, there's so much variation that I don't really know how strong the retinol is that you're using. With the prescription strength retinoids, and even though different is over the counter now, I still put it in that category because in the past it's been prescription. That is the starting prescription topical retinoid, the
Okay.
adapalene 0.1%.
Okay.
And then if I were you,
It's like your gateway drug.
Exactly
Right
right.
into retinoids.
I would start there, and then for you, I would work your way up to stronger ones. So we could do a
Okay.
tretinoin, or we could go to the adapalene 0.3%.
Okay, and is it like a 2-in-1? It fights acne and
Yeah.
discoloration?
Discoloration, and a little bit builds up collagen.
Okay.
And so as far as photoaging goes, retinoids are kind of the acknowledged first line treatment as far
Okay.
as what actually works.
Okay.
So you might want to just progress up to the different strengths. And whenever, do you peel at all with the different?
I didn't, because I am not a stranger to just over-the-counter retinol, but the very first time that I started using retinol, I went through about a week of flaky skin, and it's not fun, but I think everyone goes through that when they first start products like that.
Okay, so I think I did a post on Instagram about the different strengths of the retinoids.
Yeah, and
If
I
I
think I
remember.
actually commented and asked you a question on it.
That's probably where we talked, yeah.
We know each other from Instagram.
So as far as sticking with the theme of the TheFrugalDerm affordable skin products, with the topical retinoids, the prescription strength, there are some that are super expensive, and in my opinion, they're not going to give you much benefit above what you can get affordably. So I'm going to be making a post in a few months. I've got to go through all of these different retinoids where I try them and I see how long it takes me to peel. And I'm using some that are pretty expensive, and I'm using some that are just you can get with GoodRx for like $40.
Okay.
And I want to compare the two and see kind of what difference I notice.
Okay.
So I think that'll be an interesting post. That's a few months out.
Definitely.
But I think Altrino is one that you could consider, and that is a really good one that is Orthodermatologics kind of structured it differently price-wise, so that it's like a flat $120 is what you can expect no matter which pharmacy you go to. Whereas like some of these new retinoids, they're literally like $400 to $500, unless you go to a place that knows how to use a coupon, in which case you can get it cheap, but you're still kind of taxing the healthcare system. Whereas Altrino's $120, and it's a good one that is pretty well tolerated. But really, if you wanted to start with like a tretinoin 0.05%, which you can get on GoodRx for I think $40.
Okay.
It's even cheaper, and if you can, as long as you can tolerate it, I don't really see the benefit of buying one of those really expensive.
Would you say, starting out, how do you use a retinoid versus a retinol? Do you every other day? Do you use it at night?
So if we were to go up on the strength from the different to one like tretinoin 0.05, I would use it daily until you peel.
Okay.
And that way you know how many days you can use it before you peel, and then based on that you can gauge how often you want to use it.
Okay.
Yeah. So for example, when I started using tazarotene cream, which is the strongest retinoid, arguably the best one. When I used that, I used it for like 4 days before I started to peel, and then within another day or two, I started getting a little bit irritated from it. So that we call that retinoid dermatitis. So in that case, I would probably, if I were to use tazarotene cream going forward, I'd probably use it for 2 days and then off for a day, and then 2 days and off for a day.
Okay.
And your skin is going to build up a tolerance to it. The only downside to using something as effective as, say, tazarotene is that in the summertime, it's basically like a constant exfoliation like you're getting superficial chemical peels.
So your skin would be very, very sensitive.
And you would burn more
in
easily.
the sun. Okay.
Not very, very sensitive, but more sensitive.
More sensitive than normal. Okay.
And so there's kind of a balance. You don't necessarily want that either, unless you love being that exfoliated. And so,
I do love to be exfoliated.
And so as long as you're protecting yourself, that's fine. But I probably start with going up from Differin to a tretinoin, which is prescription, and I'd have to prescribe that for you.
Okay.
But yeah, I just like knowing kind of, like I said, with retinols, there's a lot of variability, a lot of other ingredients, and I don't know exactly what you're getting, but with the prescription strength retinoids, I know exactly what you're getting and what strength you're using. So I'd recommend that we do that, and then you let me know what other specific categories of products we want to use. So and we can talk after this. So face wash, cleanser, toner. I never insist on a toner. In fact, I rarely recommend toners. But if you like a toner, that's totally fine.
I do
like that one. So cleanser, toner, morning moisturizer, eye cream, vitamin C serum if you wanted a serum, or if you wanted the
That is
the
one thing
bleaching
that I don't use
benefit.
a lot of is a serum. And I mean, obviously I have a scar right here that I need to, I mean, it's light pink now without any makeup, but it's still, I still want to work on that as well.
Yeah.
So on scarring, and if you felt it, there is still a little buildup of, I guess it would be scar tissue underneath it. So you can still, the texture isn't quite where I want it yet, the texture and the color. So I also have, that little place on my face that I'm continually trying to work on too.
Okay. And then you've got the Differin, so you've got your retinoid in place, and you've got your nightly moisturizer. Are there any other categories that we need to consider here?
I think we've covered them.
Okay. Okay. Well, then we'll talk after this. We'll come up with a final regimen, and I'll post on Instagram what we decided on. And then let's give it a month or two and see what you think. We could always substitute a product here and there till we find one that you like. And then the real meat of the matter is I want to see how it compares. And I told your mom, you don't have to like this regimen better. That's not really the point of what I'm doing. I'm curious to see how they compare for you. I'm curious to see if you notice a difference. I'm curious to see if it makes you clarify kind of why you're using certain products and which ones you actually need. And if you think after you use this more affordable regimen, if you're going to go back to the more expensive regimen, if there are certain products you like better, that's kind of what I think I'm interested in, what the viewers will be interested in. So we'll be interested to hear back from you in a month or two.
Okay, I'm excited.
Okay, perfect. Well, thanks for doing this. Really appreciate it.
No, thank you so much.